Hi everyone, and welcome to today's video. I'm Mary Felling, physical therapist. Today I'm showing you a nice little treatment technique for the low back. Let's get started. All right, so I'm going to be showing you this technique. It's a myofascial release technique, the JFB MFR style. It's a technique for the low back to help relieve stiffness, inflexibility, loss of motion. Maybe you can't bend over as far with your low back as you used to, and this is really helpful for that. In general, what I have found is that the low back tends to be the victim of other things creating tension and pain into the low back, and it itself is rarely the problem. But there is a percentage of people who actually do have problems directly in the low back, sometimes from a trauma and just sometimes from the positions they're in all day. So what you'll need is just a surface to lie down on. I'm going to be on this massage table. You can do this on a couch. You can do this on your bed. It won't change the effectiveness, even though you have something soft underneath you. You'll need 2 pillows, and this is the technique we're going to get started. If you need to go get 2 pillows or get to a place where you can lie down, go ahead and stop this video or just pause the video and then come back and join us. For the rest of you, if you've gotten these 2 pillows ready, what you want to do is lie down so that your head is on one pillow. And it's not down under my shoulders, it's just down supporting my neck to the top of my shoulders. This other pillow, you want to pull up, get your feet supported onto the tabletop or your sofa or your bed, whatever you're working on. And this pillow is going to go underneath your rear end. It just goes under the rear end. If you watch me, it does not come up underneath my waistline. So I'm just going to lift a little bit, pull the pillow up till it's right at the top where the low back meets your fanny. And then in this position, you're going to bring one leg up at a time. And look what I'm doing. I'm holding underneath my leg. I'm not holding here. That creates strain in what we call a closed compact position for the knee. It's not good for the cartilage there. So underneath your knee, bring the other one up. And this is the position we're going to be in. And you want to let your legs just relax. And for women, we're going to kind of frog out. So the knees aren't coming directly over our chest. They're kind of coming out towards the armpit. And all you're doing with your hands is giving a nice elongation as if you're going to drive the knees that way. The legs are completely relaxed. I'm not holding up like this. I've got my hands under here. And with just ounces, I'm tractioning on the skin or on whatever you've got wearing, whatever you're wearing on your legs. And it's just ounces. And so we've got the clock started. Remember, this is a myofascial release technique, so this is going to be a minimum of 5 minutes. It takes 5 minutes to get that piezoelectric effect started in the system. Now, as you're in this position, just check and make sure you're really relaxed. Legs are hanging back. Knees are back as far as they can go. Sometimes I have patients tell me when they get in this position, it's very painful for them down in their groin. So get a towel, just pause the camera now if you're starting to have pain in your groin, and roll a towel and put it into one on the right side, one on the left side, and then get back into this position and see if that doesn't help you. All right, so we're rolling along here. And the fascial cobweb in our body is just this amazing 3-dimensional cobweb. It runs from the top of our head down to the bottom of our feet, side to side and front to back. And this fascia surrounds, it supports, and it covers and infuses everything in our body. So all of our muscles, our ligaments, our tendons, our nerves, our blood vessels, our organs, our bones, our spinal column, and our brain all have this sinewy cobweb through it and around it. Well, this cobweb through our lifetime can be injured. And it gets injured from things like just daily habits we have in our maybe a poor posture of sitting or standing. It can be injured from overuse, repetitive use. And of course, trauma, falling down a stair, getting hit by a vehicle or falling off a bike, something like that. All of these and surgery and stress cause fascia to bind down like baling wire, and it curls under, it dehydrates, and it becomes sticky and glued down. And those areas are called myofascial restrictions. Well, these myofascial restrictions can place up to 2,000 pounds of force per square inch in whatever's in their way. And when they do, that's a crushing force on these pain-sensitive structures that the fascia lies within and surrounds. So our muscles are pain-sensitive, our organs, all of our tissues, our nerves, our blood vessels, our tendons, everything. And so when there's this fascial restriction, a myofascial restriction in the area, it'll create pain, and then it diminishes elasticity and flexibility in the area. And then that leads to dysfunction and problems. And unless the fascial system is addressed, this just continues to become more entrenched and tighter through our lifetime. You know, as we age, we're literally just dehydrating and tightening. That's what's happening in our system. So myofascial releases, positions, these techniques help to rehydrate the fascia and help to elongate and soften by starting an electrical flow. It's called the piezoelectric effect. When mechanical energy of elongation, which we're doing, or compression or twisting is placed into the human body, after 5 minutes, elicits a piezoelectric flow, and that piezoelectric flow happens to move along the fascia. It's kind of like the fascia is the copper wire of our body. And what comes to these areas that are glued down, dehydrated, these myofascial restrictions where injury has occurred, it helps them to soften and lengthen, rehydrate. And so pain is relieved, mobility is returned. Now, for some people, this position is a little difficult to get into for a lot of different reasons. So there is a modification you can go to, and it would just be one leg at a time. You don't have to do both. If you're really tight and you're really uncomfortable in the low back, just start with one. That's fine. Everybody's different, so you start where you can. You would do 5 minutes on one leg, and then you would drop that leg down and do 5 minutes on the other. You can stay longer than 5 minutes. 5 minutes is the minimum time to stay in a myofascial release technique, because that's what gets the electrical flow going. After that, you can stay 7, 8, 9, 10 minutes, and you'll get more and more softening, more and more releasing. But for today's purposes, I'm going to end with this video at 5 minutes, but feel free to continue past that. All right, so we're coming up to the end here. For those of you who wish to continue on, go ahead. And if you're done, if that's all the time you have done something for yourself, one leg down at a time. Push the pillow out from underneath you. Take care of that back. And then roll like a log to sit back up so you're not twisting or giving any undue pressure into the low back. Thanks for joining me in today's video. I invite you to subscribe to my channel, and so as each new video comes out, you'll get that information right away to continue working on yourself and feeling good. Take care, and I will see you in our next video.